Hi there, Richard Laubenberg from Yellow Gazebo Natural Healthcare in Toronto on St. Clair Avenue West. I'm doing exercises to help relieve wrist pain. If you suffer from wrist pain, you may want to look at the way you are typing on your computer or using your mouse, as these are very commonly good ways to injure your wrists. Repetitive strain, carpal tunnel syndrome. These words have been bandied about for generations, decades maybe. And yeah, they're very common. Common very much across professions now as more and more of us use computers more and more to do the things that we do. On a side note, if you hear yelling and screaming from outside the room, it is because there is a Pokemon battle going on. I do believe Charizard is battling Bulbasaur. Regardless, how to deal with your wrist pain. Now, let's say this is a very simple exercise. Of course, stretching, massaging is good. If you're going to massage, once again, as I've often said, do not massage the bone. So if your wrist hurts here, you can massage actually. You've got two bones that run down your forearm here. So if you have pain, let's say right in your wrist, right where the wrist crease is, massaging a little lower down on both sides of your forearm may help relieve that. You can also press into this muscle, which is large intestine 4, on your hand, and that can help relieve the wrist. You can do some nice wrist gentle circles. One thing I would advise against, actually, because if you look up wrist stretches, you're going to see a lot of this. I do not like that. I don't like it at all, because when you do that, it may stretch the wrist forearm flexors there, but it compresses the extensors and this part of the wrist, and I think you can open yourself up to a different injury. And do you want to trade an injury for another one? No, you don't. So a common area is, say, there. So if you're getting pain on the extensor side, the back of your hand side, one thing you can do is, keeping your forearm straight, is just use these fingers to push against something like your hand, keeping the forearm straight. Now what you're doing there is you're strengthening this side. You're causing tension in the forearm side, potentially relieving tension on the other side. So it's kind of using what we call antagonist muscles to help relieve pain. So rather than stretching, or in addition to some stretching, try something like that. So don't do that. Don't do that. Please. I offer examples of actually good wrist stretches in a couple other videos that I've done. I did one, what was it? Was it about just how to stretch, maybe? Where I do this. This is a good wrist stretch, because actually it stretches the forearm and not the wrist itself. And likewise, this is good too. Those are hard to do. I'm happy to work through you. I'll do a free virtual consult if you want. You can do an actual virtual treatment with one of our physiotherapists or chiropractors if you want. Right now, check out the website, yellowgazeboclinic.com, and book a virtual session with one of them. They're discounted a little bit more than in-person sessions would be, but a chiro or a physio can give you an actual diagnosis of what they feel is going on and can tell you if you need x-rays or whatnot, and so on. I'm an acupuncturist. I've learned a lot from these people, but it's not my job to diagnose these sorts of things. I think Charizard is coming upstairs right now. So if you have any questions, please feel free to email me at richard@yellowgazeboclinic.com. I'm going to say one last thing. Heat. Please don't ice injuries. I'm happy to answer why in another video, but please don't ice your injuries. Just use heat. If you really, really find that ice really helps, okay, fine. Bit of ice, but no more than 20 minutes, and then alternate with heat. 20 minutes ice, 20 minutes heat. Okay, let the battles begin.